The pandemic was not the crisis in itself. Our healthcare system was dysfunctional. Our educational system was dysfunctional. Our access to healthy food was dysfunctional. So when the pandemic came, it just really highlighted the dysfunctional foundations that existed already.
When you know this country's history, like Black and brown people know this country's history, you would be stupid not to be mistrustful of these clinics and hospitals, knowing what segregated healthcare looks like right now.
I knew it wasn't going to be, like a cakewalk, especially for the kids that we serve. I feel like we could have and maybe should have been more prepared for anything like this.
The Transit Authority in New York City is made up of a majority of minority employees. Do you feel like you all were protected properly when you were sent out to work during this pandemic?
No, absolutely not. They literally threw us out there to the wolves. We became essential workers overnight.
As the fight against the coronavirus continues, studies have begun to emerge that show the racial disparity in coronavirus deaths. According to preliminary data, the pattern is becoming clear. Communities of color are being hit disproportionately hard by COVID-19. And as the calls to end police brutality echo around the country, people have begun to pay attention to how these disparities have exacerbated the pandemic in those same communities. On this episode of The Latest, we explored the disproportionate effects of the coronavirus pandemic on communities of color in America.
Did we treat all New Yorkers and Americans the same during this virus, or did we make a determination that some people were dispensable? That is what we have to get at the heart of. My name is Brooklyn Borough President Eric Adams. New York City is made up of 5 boroughs. Brooklyn is the largest of the counties with 2.6 million people.
Can you walk me through those first few days when we were seeing the mayor issue shelter-in-place orders?
To make sure that all non-essential workers go home.
We were closing down bars and restaurants. Brooklyn, it is a very interesting place because there are millionaires living down the street from public housing in this borough. Talk to me about the initial response to the COVID-19 pandemic from your end.
We made the mistakes from the beginning. We divided the city into 2 groups. We said essential employees and non-essential employees. Non-essential employees were able to telecommute. We gave them clear instructions to save their lives. Make sure you shelter in place. Make sure if you went out, you wear face coverings. So we gave them all the instructions that they needed. Then we said to the essential employees that you're not going to be able to shelter in place because of the nature of your job. You're not going to be able to social distance because of the nature of your job. And guess what? We're not giving you any face covering. And even if you attempt to wear face coverings, we're going to bring you up internal charges in your agencies or in your department. Ironically, over 75% of those essential employees were people of color.
The bulk of the members that move the subway and buses are minority. My name is Roberto Martinez. I'm a bus operator for the Metropolitan Transportation Authority, New York City Transit. I'm Puerto Rican, so I am in that minority category.
What were those first few days like for you when news of this pandemic spreading was kind of dominating the news at night and you still had to go to work the next day?
On March 15th of this year was the first confirmed transit employee testing positive. The Transit Authority, the following day, issued a memorandum stating that we are not to utilize our own PPE because you're going to scare the public, right?
Wow.
Yeah. And they even threatened us with writing us up, disciplining us. Then the casualties started piling up. In my depot, I lost 2 good friends, brothers, both brown individuals. That's because of the situation that we live in. They definitely changed the way we're doing everyday business.
Is it true that they had a stockpile of masks?
Yes. Tramel Thompson, a conductor for this agency, he uncovered that they had a stockpile of PPEs. And after he exposed them on social media, they magically appeared.
It's just hard for me to wrap my mind around the fact that coronavirus happened. Millions of Americans were told work from home. It is not safe for you to be outside. You all were sent outside without any protective equipment.
We were sacrificial lambs, basically.
Mentally, what does that do to you?
You have a range of emotions. You're angry, you're disenchanted, you're disenfranchised, the morale is low. We wouldn't be in the shape that we're in today. All these deaths, mostly by Black, Hispanic, we have some Chinese, the majority of them were preventable.
I believe that Brooklynites and Black and brown communities across the country had their civil rights violated on every area. Many of our residents were going to the hospital to get tested, only to be sent back home and told, we're not going to test you.
So my name is Jamila Conte. I started as an emergency room clerk, but now I'm a scheduling coordinator in a staffing office.
Since COVID-19 kind of happened, right? What were some of the things that you started to notice shift in maybe the patients that you all were seeing? Did those demographics change at all?
There was a lot of influx of Spanish people that came in. I think they were a little deterred from coming to the hospital, just scared of the bills and afraid of being turned away.
Why would they be turned away? Because they were uninsured?
There's a perception that, they're going to give me this big bill that I can't pay, or they're going to turn me away because I'm not a citizen or I don't have insurance. I think a lot of the minorities are ill-educated, that the hospital can't refuse you whether you're insured or not. A lot of people don't know that.
Do you think that contributed to COVID continuing to spread in the neighborhoods around the hospital?
Even if a minority were to feel those symptoms that they distinctly told you are COVID-19 symptoms, a lot of people were taking care of themselves, because what can the hospital do for me? I don't have insurance. I'm not from this country. So I think a lot of people didn't come to the hospital, and it just ran rampant in those neighborhoods.
One of the reasons why access to healthcare has historically and currently been a challenge for communities of color is because of our history of segregation. It's mistrust by the Black community and other communities of color of healthcare institutions is not pathological. It is perfectly warranted and a truly appropriate response to a history of those institutions not serving the needs and interests of those communities.
And when it comes to healthcare providers, are people of color being treated differently in their positions as healthcare providers? Talking about nursing staffs, clerical workers, janitorial staffs in hospitals.
I would say for nurses and doctors in particular who are people of color, the experience of being assumed to not be a nurse or doctor is extremely common. And then at the same time, I would say some of our lower paid staff who are healthcare workers, the janitors, the nurses' aides, and other assistants who work in the healthcare space are newly considered essential.
How did you feel about going to work in the hospital every day?
I was really scared because I didn't know if I was taking the proper precautions. Was I doing the right things? Should I be staying somewhere else? Our doctors stayed at hotels that were close to the hospital, but that was never offered to any of the nurses or me and ancillary staff. They kind of banked on people needing their job more than caring about their health. It's discouraging. It makes me want to cry, seriously. But that's the harsh truth about daily life in the hospital.
Ultimately, what all of those policies and actions say is whose lives matter and whose lives are not the most important. And that, unfortunately, is even more clear in the COVID-19 era.
My name is Joshua Foster. This is actually my second year teaching. I work for Indianapolis Public Schools, so I would say 95% African American.
Have you seen any negative outcomes since, we've adapted to this new normal?
Definitely, man. When we first started this whole e-learning thing, it was difficult because, some kids might have had access to Wi-Fi, but maybe not necessarily had the devices to be able to do so. And then it was some kids who, just didn't have Wi-Fi due to, their parents' financial situations at home. So you just probably never saw them log in at all. I got faith in the kids, man, but I can definitely see that this is just not a motivator for them. Because some of the kids, they needed that person to, kind of push them along, because they just weren't interested. They might be coming from a situation to where their parents might not have even made it out of 8th grade. It's just a crazy situation overall.
Thinking about how people are talking about you need to defund police departments in order to reroute funding to school systems like yours to help close this gap. How do you think about those things right now?
I'm all for, defunding the police, especially when they've been defunding education for a while, man. So, Like the school that I'm at, there is no art, there is no music, there is nothing like that. That might even have an effect on crime rates going down. If these kids have more access, the police will be, less likely to find them on the streets doing stuff that they probably shouldn't be doing. I honestly, truly believe that, the kids do want to learn. They want to be better. They want to have, a good job and live a successful life.
This is an important opportunity for us to use what happened under COVID-19 as a way of mandating our cities and our states for changing the institutionalized racism that has existed in this country for so many years. We have to move forward better than what we were. We can't duplicate the processes that we had in place prior to that. So I'm optimistic, but I'm determined also to make sure we don't go through this again.